You're listening to The Mountain Spirit, a podcast of Christian Appalachian Project, where we explore the stories, voices, and change makers shaping Appalachia. May is Mental Health Awareness Month, and today's guest is Dr. Andrea Brooks. She brings more than 20 years of experience as a mental health professional and also as an educator of counselors. Hey, Dr. Brooks, welcome to the show.
Hi, Tina. Thanks for having me.
Well, we're so excited to have you on today, especially like we said, it's Mental Health Awareness Month. So we want to shine a light on the good work that is happening in Appalachia, but also talk about some of the challenges there. So I know that you're from the area, so can you share a little bit about your upbringing and why was it important for you to stay in Eastern Kentucky?
Sure, that's a great question. So I live in Eastern Kentucky in the Red River Gorge area. It's a very beautiful place to live, and it's where I've lived my whole life. I graduated from Wolfe County High School, and I went to undergrad 2 hours away at Center College, and moved back home and almost immediately got married to a local hometown guy who was an established teacher in the area, and it just made a lot of sense for us to stay in Eastern Kentucky. And I probably would have anyway, because I have strong family connections here. And it's just a great place to be raised and to raise your kids.
Yeah, I love it. I think we hear that thread whenever we ask that question about why people stay when there's maybe people telling them they need to go someplace else and you can't be successful here and all the things. But yeah. They have careers and raise their families and have a great life. And so thank you for sharing that.
And to be honest, I couldn't imagine starting a new life somewhere else. Having children and having built-in babysitters, just a mile down the road was incredibly helpful. It's just unfathomable to me how people move away to a city where they have no support built in.
Yeah. So let's dive a little bit more into then your own inspiration. So what was your inspiration for getting into counseling and choosing that as a career path? And what kept you in that field for over 20 years?
Yeah, that's a great question. So personally, when I was growing up, there was not a lot of counselors as an option. Licensure in Kentucky did not exist until the late 90s. And so in the early 90s, my parents actually got a divorce. And it was a time that I remember I could have used someone to talk to during that time. And that stuck with me growing up, how even as a young child, I understood that there was a shortage in an area to meet those needs. Yeah. So as I continued to get older and life events happen, went away to college, it was just obvious that psychology was going to be my major. And when it was time to move back home and get married and figure out how to find a job, in an area where jobs are not plentiful, it was obvious that the jobs I was attracted to were those of counselors and helping others. So I decided to go on and get a master's degree where I could get licensed to help people in that way, and started a job as a counselor and have never looked back.
There you go. So, but you've also had the experience of being not only a practicing counselor, but you're also an educator. So can you talk about how that shaped the way you prepare those experiences together, how you prepare the next generation of mental health professionals?
Absolutely. So it all kind of happened by happenstance in the beginning. I was, very satisfied continuing to practice as a counselor. And the school, Lindsey Wilson College, now university, where I received my master's degree, they had an opening on the Hazard, Kentucky campus. And although their mission was to go out into Appalachia and train folks from Appalachia, in the beginning of that program, they had a severe shortage of people from Appalachia to teach in Appalachia, to train people in Appalachia, to be counselors in Appalachia. Which I love the mission statement, and it's very consistent with what CAP does. So they asked me on a whim if I could teach a class that they had a hole in on their schedule. And I did, and just loved it. my mother's a teacher, my husband's a teacher, everybody growing up was a teacher, and I swore I would never be a teacher. And I guess I'm not. I'm a professor, but it's the same thing. So
Yeah.
it's kind of been in my blood, and I realized that while I enjoyed practicing, teaching allowed me to actually reach more people, because I get to teach people how to be a counselor, and they get to go be counselors and help people. And so it's kind of like an exponential, you know,
Yeah.
addition to the work that I was doing, and I've loved it.
Awesome. Okay, so you also we talk about your clinical work. So you were practicing counselor. So that work spans schools and foster care and substance abuse and homelessness. So when you think of those kind of diverse needs that people have, what common threads have you seen across those different areas when people need mental health services?
Yeah. So thinking about that clinical practice, I started out working in residential treatment for children in state's custody. Um, I then moved into a foster care setting and then into school based counseling right at the beginning when school based counseling was starting. Um, and then provided some counseling services for a group that provided health care for the homeless. Um, to me, a common thread um, is a sense of hopelessness. And I think if I had to think about all of those populations that I worked in, the most effective strategy of helping the clients was instilling hope. Um, they did not see a good future ahead for them. They did not see job offerings. They did not see a clear plan of how to be successful. And counselors are really good at giving hope. And I think that even more than finding a diagnosis and getting medication and the medical model way that a lot of folks practice, that talk therapy of instilling hope in clients was incredibly effective.
Yeah. Can you mention school-based counseling? How did you deal with helping kids that might, like the stigma of getting help or like maybe, people finding out that they're going to talk to a counselor? Like, how did you manage that with kids in school and making sure that they were still getting the help that they needed?
That is an excellent question. When I first started as a school-based counselor, there were several parents who wanted their children to have access to the counselor, but did not want it to be obvious to the classmates that they were going to counseling. And the whole concept of school-based counseling was created in order to help attendance. So the students that needed to have a counseling appointment were having to be checked out of school, driven by their parent to the office, and then driven back. And so, in order to kind of combat that tardiness and school absenteeism, they put the counselors in the schools. Now, the downside of that is, it was really obvious when they would be called to the office, or, they would know that when the kid left every Tuesday during fifth period, they were going to see the counselor. So that's something that I've actually tried to combat, is to allow that school-based counseling to happen and still keep the confidentiality that's needed. And in my work on the licensure board, when we would have people who were looking to have supervision agreements approved and wanting to practice as a provisional counselor, and they would say they're going into school-based counseling, that was always the number one question from me was, tell me how you're going to maintain confidentiality.
Yeah.
What I've noticed recently, at least in the last few years, having students in the schools seeing a licensed counselor during the day has become so normalized that there's not really a stigma
Yeah.
there anymore in the lower grades, because it's just a normalized behavior. And but I would agree that confidentiality issue is still there, and something that folks in these agencies need to work on.
Yeah. Okay. Thank you. Thank you for that. So you've also served in leadership roles at both the state level and national level. So how have those experiences in leadership in this field shaped your own perspective on access to mental health care, in particular when it comes to rural communities?
The leadership roles that I've had at the state and national level, I've been very grateful for. because they do allow me to bring my rural Appalachian perspective into those meetings. And that's kind of what I'm known for. When Andrea is present in these meetings, we're going to hear the Eastern Kentucky perspective
Yeah.
about the issue. Um, it has allowed me to keep the problems that those national groups are working on focused on the needs of Appalachia and Eastern Kentucky. For example, at the state level, if you do the math, there is one licensed professional counselor for every 100 Kentuckians. And licensed professional counselors diagnose, assess, and treat mental illness. And so we also know that out of those 100 Kentuckians that there's one licensed counselor for, not all of those will have a diagnosable disorder.
Yeah.
However, that's a little misleading because that ratio is not the same in rural areas. Maybe in Lexington or Louisville, there may be one therapist for every 100 people. But we know that in Eastern Kentucky, there's not really one therapist for every 100 Eastern Kentuckians. So if the folks in those national organizations are hearing those statistics, they may think the field is more saturated and they don't need to continue, giving incentives to produce more quality counselors. But they can hear from me that yes, that statistic is there. However, that's not really what it looks like.
Yeah.
And I think it's important that we continue to have people in the seats at those tables to be able to show the real truth, the real perspective.
Yeah, that representation matters, and having someone from the area to advocate is very important.
I
And
would
I'm glad
agree.
that you stepped up in that role. And I know we have counselors like Dale and Chris that serve at CAB that also really, lead in that way and making sure your voices are heard at the state level and the national level as well.
And I will add that, to give Chris his flowers, he was a very good mentor to me in that state regulatory role and really encouraged me to get on that national level.
Yeah, I love it. Okay, so let's talk a little bit about Mental Health Awareness Month, which May is Mental Health Awareness Month. Great time to spotlight mental health in all of its variations, whether that's self care or just, taking time out for your own mental health or actually going to see a mental health professional. But from your perspective, what feels most urgent right now when we think about mental health when it comes to Appalachian communities?
I think, I think the easy answer is substance use. I think that a lot of people associate Appalachia and substance use. I think that that's true, but I would argue that substance use is anywhere where there's hopelessness and lack of availability of services. Not where it's harder to treat mental health, you're going to see a lot of substance use and a lot of self medication. So I do think we still have a lot of work to do in that area. I think that we also have some work to do. To get a little specific, I think that we've been so focused on increasing the quantity of providers that we have maybe neglected the quality. So I think that folks in Eastern Kentucky deserve quality licensed professionals,
Yeah.
whether that's a licensed professional counselor or a licensed clinical social worker or a licensed psychologist. I think it's very important that our friends in Eastern Kentucky and Appalachia are educated to know that quality services come from folks with a license.
Yeah. So talk a little bit more about what that license means, because it's not just a piece of paper. So can you educate our listeners a little bit more from that
Oh,
perspective?
absolutely. Myself and Chris Griffith, who you mentioned before, we've both served multiple terms on the state's licensure board for professional counselors. And this is true similarly for all of those boards that I mentioned earlier. But in order to get a license in professional counseling, you have to have a 60 credit hour master's degree in counseling with specific coursework in certain areas. You have to pass a national exam. You have to have 4,000 hours of supervised experience with a licensed professional counselor as well. so many things in order to meet the state standard of the requirements needed to be a professional counselor. And then even beyond that, the credential continues to be renewed because that regulatory body regulates those who have a license. And to me, that's the hard part about folks without a license providing services. They don't have any standard to be held to, right? And there's no one to complain to whenever there's a problem. So that's the two important things. One, if someone's licensed, you know that they have the qualifications to be a minimally qualified candidate, and you know that there is a regulatory body that's holding them accountable for their actions.
You can make this summer into a season of service and have a lifetime of impact on youth in Appalachia. Join us in the great outdoors by becoming a camp counselor at one of our 2 beautiful camps in eastern Kentucky. Room and board, stipend, travel reimbursement, and educational award are available. Apply today at christianapp.org/volunteer. That is christianapp.org/volunteer.
Mental health is also closely tied to basic needs like housing, food, and stability. Those are all areas that CAP works to address in our mission. But can you talk about how those challenges intersect for families in the region when they may be struggling with those issues as well?
Absolutely. So the previous question you asked about what I think is still an issue in our area, I almost said basic needs as well. Even though we have great organizations like CAP and other similar agencies, we still have an epidemic of people in our areas that are struggling to meet basic needs, to get housing, to get consistent food sources. I remember, when schools were shut down for COVID, my husband is a principal in our community, and I just remember the big focus was how are we going to make sure that our students have meals, because some are used to getting them during the school day and they're not anymore. So there's a big focus on sending buses out to deliver food. Thinking about it from a mental health perspective, there's this thing in counseling that's called the Maslow's hierarchy. And there's a pyramid about, all these needs that need to be met in order for someone to live their best life. The bottom levels are the basic needs, the food, water, shelter, clothing. The next level is safety. That could be domestic violence relationships. That could be locks on your house, alarm systems. And then above that is self-esteem and belonging to groups, and then being self-actualized. I see CAP as meeting those bottom levels, those basic needs. And case managers are good in that area. Peer support at the substance use facilities are very good in that area. Counselors come in after the basic needs have been met and help folks with self-esteem, with mental health issues, diagnoses, and the like. It's almost like counseling can't work very well until the basic needs are met. So I do see it intersecting in that way, that counselors need places like CAP to help fill those basic needs, so then counselors can come in and do their job.
Yeah, and I think it's probably goes without saying that if you're thinking about, do I have enough food for my children to eat, or there's a hole in my roof that I can't fix, that you're probably not thinking about, can I get to a counselor or can I pay for a counselor, because you're just trying to survive.
Yeah. I mean, if you're hungry, you're not worried about your self-confidence, right?
Yeah.
It's just, you're going to be thinking about finding food. So absolutely, CAP does an excellent job of helping people meet those basic needs, so then counselors can do their job.
Yeah, love it. So we already talked a little bit about the ratio of mental health professionals in rural areas. So let's drill down a little bit more onto that. How does that show up, and how people, whether it's individuals or families, seek care or get access to care? I know our team does a lot of family counseling as well, not just like the child or the spouse, but really looking at that family counseling. But what impact does that have when there is a shortage of, as you talked about, there's a difference if you live in Lexington or Louisville, the 2 biggest cities in Kentucky. But when you're in a small community, and maybe the closest counselor is 45 minutes to an hour away if you're talking about a visit. Like how does that practically impact whether people can get access and to a licensed professional and all those things? Can you speak to that a little bit?
Yeah. So first thing that I think of is just an issue, a barrier when you're counseling in small communities. Um, when I was practicing, I did not prefer to counsel in my direct community because there's so many opportunities for dual relationships. And I was afraid that people would not be comfortable coming to me because maybe my husband was their principal,
Yeah.
or maybe their mom goes to church with my grandparents, or there's so many connections. I mean, you can probably name everyone in your community as well. I mean, it's so small. So it's really hard to be a counselor in a small town. You often see counselors in a small town counseling in the next town, and then someone from that town is going to counsel in
Yeah.
your town to reduce those dual relationship barriers. But to specifically answer your question, in Eastern Kentucky, in our small rural communities, we either get access to counselors through proximity. Whose office can I drive to and actually see them in person? We call it shared air, because in person, you and I are in person now too, but it's a little different. So you either whoever you can drive to, so proximity, or whoever's willing to do telehealth virtually. And so some folks just really don't like the telehealth. They don't feel like they can make a good connection with their counselor. They need it to be a little more intimate, and so they would prefer driving to someone. When you are in a small town and you're trying to get access to a counselor, a licensed counselor, you're limited on who you can drive to. And so you don't always get to pick the perfect counselor for yourself based on maybe you would prefer a certain gender. Maybe you would prefer a certain a belief on certain topics, or maybe you need a specialty. Maybe you need EMDR. Maybe you need some certain theory that isn't offered in proximity. So now we have to hope that someone virtually, you can join a session and be able to get that need met. I think also in Eastern Kentucky, I think we assume that everybody on the planet has access to the internet now, but we still have some broadband issues and some limited Wi-Fi for folks. And then the transportation needs to get to where there's Wi-Fi to be able to access these counselors. Now, some folks don't like counseling through telehealth. However, it has opened up so many doors and opportunities for clients in our area to have access to specialists. And that has really been a game changer for the mental health in Kentucky. They're no longer limited to proximity, who they can drive to. They can actually choose a counselor that's a really good fit for them that way. I would also add too, Kentucky is a part of the Counseling Compact. It's an interstate compact that, if you're familiar with nurses, if you've ever been in the hospital, sometimes your nurse is a traveling nurse. They're actually from another state, but they're visiting for a 6-week contract. Counselors now have that. And so Kentucky is a part of it, but they're not active right now. They're having to do some legislation to be able to be in compliance with the compact to be able to offer it. But soon we're going to be increasing that ratio from one counselor for every 100 residents to really unlimited, because we're going to have people from all over the country who are available to be therapists to our Kentucky residents.
Yeah. So you mentioned telehealth, and I think we have one more question about telehealth, but what would you, what like practical advice would you give to people? Because of course there's all kind of apps and things as well. There's just like, hey, you could get a counselor, just go into this website. So when people are evaluating those kind of apps and things like that, or counselors what practical advice would you give them in terms of making sure they're getting a quality therapist?
That is a really great question, and I'm very grateful to get the opportunity to answer it, because this is a really important PSA for everyone in Eastern Kentucky. There are tons of apps out there, and we see their commercials on TV. Lots of national companies that are that have been created since COVID, especially to help meet this need. And some are great companies and some are not. So we do need our friends in Eastern Kentucky to be educated on how to find the right fit for them, but also the legally correct option as well. So you definitely want to make sure that your counselor is licensed, but it's also a requirement that your counselor is licensed in the state where you reside. So if you are a resident of Kentucky, if your driver's license says you live in Kentucky, if your voter registration is in Kentucky, then you are a Kentucky citizen, and that counselor needs to be licensed in Kentucky. Their license in California or their license in Colorado is not going to work for you to be able to receive counseling from them. There's also, if they go to lpc.ky.gov, there is a search feature to kind of verify a license. And so if you know your counselor's name, you can put their name in there and it will pop up if they are a licensed professional counselor, and if they're current or if they've been expired or if they've had any disciplinary actions. So you would know if they're an ethically operating licensed professional counselor as well. Yes, very
Awesome.
Great question. Thank you.
I love that. And it's a very good answer.
Well,
So
thank you.
I love that PSA. We will take that. So when someone, if they are looking in their family or they see a loved one and they maybe have some concerns or worried about their loved one, what's a good first step for them to start the conversation with their friend or their relative?
Yeah, it's a great question as well, and of course, it's going to be case specific. You know, every person is going to have their own individualized needs, but I think that I think it's easier to say initially what not to do. So I would not suggest overwhelming the loved one. When I think about, letting a loved one know that there's an issue and trying to gain awareness for that, I think of the television shows Intervention, and where they have those big interventions and everybody kind of gangs up on the person and they become overwhelmed. We want to avoid that. That's not incredibly therapeutic and safe for the client. But reaching out individually at first, and first expressing that you care for the person and that you care for their well-being, you want them to be safe, to be healthy, and here's what you're noticing. And offering to take whatever first step you decide on with them. You can go to an appointment with them. Let them know that there is no stigma anymore for getting mental health care. And just offering to help them with that first follow through, I think would make a big impact.
Awesome. That's a great basic information, I think, to help equip people. So also we know again, we already mentioned May is Mental Health Awareness Month. So what message do you hope stays with people long after this podcast is over and they've heard it and they've like, great job. We've learned so much from Dr. Brooks today. What do you hope that they take with them from this conversation?
I hope that they take away that, again, that there is no mental health stigma anymore. Access to care is much more prevalent than it used to be. And we are all much more focused on improving the mental health of our friends in Eastern Kentucky and all over the state. I want to also make sure that people remember that not everyone who says they're a counselor is a licensed counselor. And it's very, very important that when they're receiving services that they do so from someone that has a license.
Yeah. So that triggered this thought for me as well. Sometimes people are wanting a label or they're wanting to know, like, what is this thing that I'm feeling? So can you speak just a little bit more to how counselors diagnose and why diagnosis is important and how it's used and what's the difference between that and stigma and labels and all those kind of things?
Sure. So in the counseling mental health profession, there's lots of folks that have the ability to diagnose. There's licensed clinical social workers, licensed psychologists, and then licensed professional counselors. Being able to diagnose is what separates a lot of the LPCs from other counseling professions. We have the ability to diagnose, assess, and treat. Diagnosis is a very powerful tool. So it has the power to make someone feel relief, but it also has the power to add to the stigma. So diagnosis was created really not to just label people, but to actually be a way that counselors and other mental health professionals can communicate with each other in this standardized clinical language. So we know that this person who has this collective appearance of symptoms has this diagnosis. Now we can communicate about that person, and also we can research that diagnosis and know that there's evidence-based treatments that can improve those symptoms. So with diagnosing, when clients come to us and they receive a diagnosis, they've come to counseling because they're feeling poorly, right? They have feelings that they just don't want to have anymore, thoughts they don't want to have anymore, behaviors they don't want to have anymore. And they can sometimes feel, especially if they're looking around their small community and they don't see anyone or hear that anyone is thinking, feeling, or acting in the same way they are, they think they're the only person on this planet that feels that way. And so when they go to a counselor and they hear that there's actually a term for it and that there's research done about it and there's treatments for it, it can provide so much relief to allow improvement in those symptoms just by receiving the diagnosis and receiving hope. So yeah, that's diagnosing is a very powerful tool. And when counselors use it well, they see great improvements in clients.
Yeah, thank you. I know we talked earlier about meeting people's basic needs and how like that's necessary before people can think of like self-actualization and all the sort of the higher needs. But I wonder if you could speak a little bit more to when people are like they don't have the right nutrition because they don't have enough food, or maybe their sleep is impacted and maybe they are stressed and worried and they're not getting a whole lot of sleep. Like, how do those things also impact maybe if you already have a mental health issue, or how does it just like your mental well-being when maybe it's a nutrition issue, it's a sleep issue, even if you have a diagnosis and you're seeing a mental health professional, how does your sleep and your diet impact mental health?
Sure. So all of the professions that I've talked about, they all operate from their own scope of practice through their own lens. You have psychiatrists that operate from that medical model of you diagnose a problem and you fix it with a medication or some form of treatment. So counselors operate in that world. We have to be able to be reimbursed by insurance. So of course we have that medical model. But the lens, the philosophy that separates counselors from the other mental health professionals is we operate from a wellness model. It's not so much that we cure mental illness and diagnoses. It's actually our intention is to help the client be well. And sometimes that means to help improve or eliminate some of those symptoms, but it mostly means looking at the client holistically and looking to see maybe what parts of their daily functioning and daily habits might be leading to some of these negative symptoms that they're feeling. And yeah, absolutely. A counselor is going to help a client evaluate their sleep and improve their sleep habits. Absolutely, to look into nutrition. But we have to make sure that we stay within our scope of practice. So we're not dietitians. We're not sleep specialists, so we have to be very careful about what kind of recommendations in those areas that we give, but we absolutely would refer clients to specialists in those areas and work concurrently with them. So that's one of the great benefits of places like CAP and other community mental health agencies is having a holistic approach, like a one-stop shop where someone can come in and get multiple needs met, but also that allows all of the providers of those needs to be able to have staffings and communicate and make sure that the client isn't just receiving mental health treatment, but they're also getting needs met holistically.
Awesome. Andrea, you have been such a wonderful guest for our Mental Health Awareness Month episode. But I would be remiss if I did not ask you, because we talked a lot about Eastern Kentucky and being from Appalachia. What makes you proud to be Appalachia?
Ah, man, I could answer this question in so many ways. I think what makes me the proudest is the connections. and just the hearts of the people. I mean, this is a place where if you run out of gas on the parkway, somebody's going to stop and offer to go fill up the can for you.
Yeah.
You don't get that in a lot of the bigger cities. So I think my answer has to be the connections that we have.
Awesome. We always ask this last question before we wrap up. Is the mission statement of Christian Appalachian Project is building hope, transforming lives, and sharing Christ's love through service in Appalachia. I think I know what you're going to say on this one, but I'm going to wait to see if you surprise me. When you think of hope, transformation, love, and service, out of these 4 words, which one do you think embodies the Appalachian spirit the most?
Oh man. Well, for me personally, service is the key word. That has been a big part of my life. And even now, in preparation for thinking about what we would talk about today, I started looking at a lot of my activities, and I spend way more hours each week on my unpaid service obligations than my work that I actually get paid for. So for me personally, service, but I think what embodies us and where we need to focus a lot of our energy in Eastern Kentucky is hope. When we start instilling hope, that's gonna move a lot of mountains here, and pun intended.
I love it. Andrea, it's been an absolute pleasure. Thank you so much for being on the show today.
Thank you so much for having me.
Our guest today was Dr. Andrea Brooks, a mental health professional and educator with over 20 years of experience. Thanks for listening to the show, and you can catch new episodes every Tuesday and invite your friends to listen too. Follow the work of Christian Appalachian Project on all social media channels, and you know that you can find the show at christianapp.org/podcast or wherever you get your favorite podcasts. If you like the show, be sure to follow, subscribe, and join us for our next episode. This shows your support for the show, and it also helps other people to find us. Until next time, this is The Mountain Spirit. Keep listening, keep learning, and keep lifting up Appalachian voices. We'll see you next week.